I'm Jim Clear. I'm the director of the New Mexico Veterans Integrative Health Program. This program was to serve any veteran of any age, any gender, any condition or ability at no cost, and to introduce them to integrative therapies. A big part of these therapies is the use of osteopathic manipulation, and most specifically, craniosacral therapy. And we do this because chronic pain is not only a major problem for over 100 million Americans, but it affects active military and veterans disproportionately. And by that I mean 45% of active duty military report chronic pain, and well over 50% of veterans report chronic pain.
I found out about this integrative program through NMSU. It was a free service to veterans. For this integrative service, they did a survey on us about whether we had disabilities, questions, concerns, anything that could limit our ability to take part in the program.
It's a really difficult challenge. We have not been treating the entire patient, and we're just treating their symptom. The tenets of osteopathy are pretty straightforward. The body has, the body's a unit. The body has self-healing and regulating mechanisms. Structure and function are interrelated. And my favorite is rational treatment is based on knowledge of the other three.
We are an osteopathic medical school, meaning we're founded on the philosophies of Dr. Andrew Taylor Still. Now, Dr. Still was an MD physician back in the 1800s who became very disgruntled with how medicine was practiced at that time. He was very discouraged by the use of narcotic pain medication at that time, and he felt like these war veterans from the Civil War were just being drugged up with these pain medications and alcohol.
The power to heal is not just about giving a prescription. The power to heal is to actually involve yourself in that person's world. Touch enables us to do that. It builds trust, it builds comfort. And we also know that the body is full of fascia, and this fascia acts as a capacitor. And so when we get injuries, when we get traumas, whether they be physical, emotional, psychological, or spiritual, we get these traumas, they stay in our physical body, in the fascia, and it binds up. And that breeds stasis, and stasis breeds disease and illness. A part of the osteopathic education that we have here is the concept of the osteopathy in the cranial field, or osteopathic craniomanipulative medicine. There is a fascial link between every part of our body, from our brain, our skull, down through our spine into our sacrum. And that core link, it's protected by everything else around it. And when we have injury or we have trauma, our body recoils and we get shock, and it stays in our spinal cord, it stays in our system.
Worst thing that happened to me in the service as far as injuries was when the hatch door shut and they have metal things, and it caught me on the shoulder. Automobile accident, which broke many things, including both legs, and I still have a plate in my right leg. But ribs, and, it was a bad accident. But it was a long struggle in the hospital. Just understanding the healing that needs to be done. I'm beginning to. I need more of your instructions. And I look forward to completing the program.
I was starting to become so depressed that I didn't want to get up and do things with my children. I was so tired all the time that I didn't want to do anything. I'd go home, do my homework, and kind of be done for the day. And since I started this program, I'm able to have the energy to go through the day and do all the things I need to do as a mother, student, and wife. This program has been amazing. I've learned a lot about myself. I went in there with pelvic pain, hip pain, back pain, shoulder pain, and anxiety and depression, and I'm coming out handling all of that a million times better than when I went in.
Cranial manipulation enables us to position the body to a place where we can expel those shocks and those traumas.
Its origins are in osteopathy. The reason we use it, its key role as a tool, is it really helps us to put that veteran in a deep parasympathetic state to promote health and healing. If they're in chronic pain, this is a tool uniquely suited to address all these problems. And what it does is it puts that man or woman on a path to understanding themselves and giving them a tool to begin the health and healing that they seek uniquely for them.
Jim and David have both given me tools that I can take home, that I have taken home, taught my husband, and he's been able to do some of the mind-body stuff to me.
The major difference is that the integrative approach recognizes the whole person, not just a physical condition. And the manual therapies and the mind-body therapies are well recognized and in use in all the major academic institutions and hospitals in this country. And only recently, the director of the National Institutes of Health, Dr. Francis Collins, mandated that the VA, the DoD, and Health and Human Services begin researching and implementing these therapies for all active duty personnel and also for our veterans. It will take time to ramp this up. One of the interviews with our veterans, he's missed out on this approach for almost 4 decades. He cannot wait another 6 to 10 years for this to become part and parcel of everyday care, whether it's at a VA facility or at the CBOC. So I'm very grateful to the American Massage Therapy Association, the medical advisor and director for this program, Dr. John Manfredonia, combat veteran and also an osteopath. In this community, Dr. Tracy White, a clinical pharmacist and professor. The power of human touch, that when we can help the body, we can deeply, profoundly affect the mind. And when we can work with the mind, with the brain, we can have just as profound effects in that person's body. And what you hear time and time again, over and over from these veterans, is how they begin to understand what's going on with them.
And all of these things combined it's changed my life, and it's only been a month and a half that I've been in this program.